So I'm here with Evan Ingerson. And Evan, tell us a little bit about yourself.
Good to be with you, Jared. My name's Evan. I'm a physical therapist. I'm stationed out of Boulder, Colorado, at a practice called Mend Physical Therapy, and I work primarily the vast majority with rock climbers. And so I'm a lifelong climber myself, climbed all through the youth competitive circuit. Wasn't quite good enough to make it in the pro world, but luckily it kind of came full circle that I'm still able to make my living and getting a lot of time working with climbers, just on the other side of things. So that's my main job, is working with climbers, and I'm excited to talk about tendons because that's something that climbers talk about and get injured a lot.
Yeah, and for everyone that's listening as well as watching, because this is also available on YouTube and on the webpage, is Evan wrote an article on tendons, and this will be the article that we'll be referencing as we go along, and we'll link that as well in the show notes so everyone has availability. And for those of you watching on the screen too, there'll be images from the article and a couple different clips so you can put some visuals to what Evan's talking about. But Evan, let's go for it. What should we know about tendons? That's the topic today.
Okay. Oh man. So we're
It's a lot,
gonna,
right? It's a huge, huge
yeah,
topic.
it's a huge
Tell
topic,
us
and it is one.
everything that you know.
Exactly. And then it'll be wrong in a year. So it is one of those topics that is evolving and changing, and we're learning a lot of new stuff about it, but we're getting a pretty good hang of it as in healthcare, we're getting a pretty good understanding. And so tendons are the connective tissue that connects muscles to bone. And so the vast majority of muscles in our body, the vast majority of movement in our body comes from a tendon attaching to a bone. That tendon turns into a muscle, and then on the other side of the muscle, it turns back into a tendon and then attaches to a different bone. The muscle contracts, pulls on the tendon, and that pulls the two bones closer together. And that's how the majority of our movement is made. And so tendons are made out of a variety of things, but in general, they're made out of fibers called collagen and what we call the matrix, the stuff in between. And what's interesting is that tendons kind of shift our paradigm of how we think about injuries. And we don't need to get into detail too much. It really only matters that that is a kind of a different paradigm, because it tells us that we can treat these things differently than other tissues. And so when tendons get injured, what tends to happen is we get injury to the substance between the fibers, the matrix, rather than the fibers themselves. And so it's actually very, very difficult to tear those collagen fibers. And when we get tendon injuries, it tends to not be the collagen fibers that are irritated. It tends to be the substance between the fibers. And that means we can load things a little bit differently. Climbers get a ton of tendon injuries. The most common places are in the elbow. So lateral elbow tendinopathy. So tennis elbow or medial elbow tendinopathy, golfer's elbow. We get rotator cuff tendinopathy and also biceps tendinopathy, sometimes even hamstring tendinopathy. And so we get all these injuries to tendons from either repetitive stress or a more acute impact on the tendon. And it happens all the time with climbers.
So we can probably nerd out and go in depth into like every single component of tendon injury that's occurring. But can you just paint like a subtle picture for maybe a climber that doesn't know the intense anatomy related to this of what actually is happening? You talked about the matrix and so forth, but when a tendon is injured, what is going on? Like, why does a climber have pain in that area? Like, what's going on from a simple physiologic standpoint?
Yeah. Think of the pain as coming more from disorganization within the tendon rather than the tendon, a tissue tearing. And so the analogy I like to use is a nylon hammock versus a nylon climbing rope. So if we take our climbing rope, it's very highly organized. It's the same type of fibers. They're structurally organized to do one thing in particular, and that's to catch you when you fall and be really strong in one direction. If you squish a climbing rope in the opposite direction, it's not very strong. But if you pull on it, it is super duper strong. A nylon hammock is made out of similar material, and it is kind of strong in one direction, and it's also strong in another direction. So it's meant to be stretched in all these different directions. But it's not going to be super strong in any one direction. So you're not going to trust your life to a nylon hammock, but you will to a climbing rope. And that has to do more with the organization of the tendon rather than the actual structural components of the tendon.
That totally makes sense. And I think that gives that visual, right? Of like, okay, that's if a climber's listening and they have tendonitis, osis, or tendinopathy, that they can understand now, okay, all right, normally it's this climbing rope, very strong ability to resist tensile stress. And now maybe I have a little bit of some hammock in between there, is what's happening. So I know you talked in the article about tendonitis, osis, apathy, um, even algia. Like there's some debate in the medical community of what's going on. Um, can you describe a little bit more about each of those, maybe when it occurs, and your thoughts on the words, the terminology?
Yeah, absolutely. So when it comes to talking about tendons, the common thing you hear is tendonitis. I have tendonitis in my Achilles, I have tendonitis in my elbow, and that is just a shorthand and at this point lazy way of talking about tendons, because what we find is that the vast majority of the time, the itis part of it, tendonitis, itis means inflammation. The vast majority of the time, there is not inflammation present in the tendon that is painful or injured. But there are times when there is itis, when there is inflammation going on in the tendon. And so my goal for you with this podcast is to help you understand, is it okay to load this tendon right now, or do I need to totally rest it? And that will depend on whether it is a tendonitis with inflammation or what we call a tendinosis or a tendinopathy, which are injuries to the tendon that are outside of the inflammatory process. And so if we just kind of break it down into if you have an inflammatory response to the tendon or not, that's how we're going to decide whether we want to load it or not load it. Because it turns out a lot of times when we have tendon injuries, we actually want to load them. And if we don't load them, the injury will progress. So it's very counterintuitive. We'll go with fairly general guidelines here. And of course, you should be consulting your healthcare provider and making sure that your healthcare provider is up to date on the latest research on tendons. But we'll just say this. It is likely that you have an inflammatory process going on in your tendons if you are maybe on the younger side, 35 or 40 years or younger-ish.
I'm
If
glad
you've
that's
been
considered the younger side. That's nice to hear.
yeah. And then if you've been climbing for fewer years, so you haven't put as much repetitive stress on those tendons. So I usually say, 2 years based on my experience. Climbers who have been climbing for 2 years tend to get different injuries than climbers who have been climbing for fewer than 2 years. If this is your first time, or maybe just your second time getting a tendon injury, and especially if you get swelling in the area, that can be indicative of an inflammatory process. And I think the big thing is just the repetitive stress. And so if you have greatly increased the amount of climbing that you've done and the intensity of climbing that you've done recently over many times of doing it and over many weeks, it's more likely that you're going to end up with an inflammatory process, as opposed to if you just aggravate and overdo it with your tendons one time and that causes your symptoms. It's less likely to have inflammation. And of course, this is all relative, but these are the general guidelines that you can listen to at home and take home with you.
Okay, so where do you go from there? Let's say you've identified, you say, all right, I have tendonitis, or I have tendinosis, or I have tendinopathy. So we know what it is, we've tagged it, we've identified it. What's the next step? Obviously you have to rehabilitate it.
Yeah, exactly. You have to decide, should I use this or should I not use this? And for other parts of the body, in general, you want to not use it, to let it rest before starting to use it again. Sometimes with tendons, we want to start loading it right away. And so the flip side of all those things I just listed, where it's more likely that you have an inflammatory problem, tendons also get problematic because of more degenerative changes over time. And so if you have been climbing for longer than 2 years, or 2 decades, if you're more likely to be older, like over 35, over 40, anything above that, if you've had tendon pain multiple times over the years, if you have um, pain that gets better with activity but gets worse the next day, that is a hallmark of not having inflammation but having a tendinopathy, which is, so just so everyone is clear, we have the tendonitis, which is the inflammatory process, and then we have tendinopathy, which is the more degenerative process that causes pain without inflammation. And so if you have pain that gets better with activity and feels good and you're doing well while you're climbing, and then you wake up the next day or 24 hours, you have more pain, that's much more indicative of a tendinopathy that doesn't have inflammation going on.
And
And
you treat these
yeah,
differently, obviously.
yeah, exactly. So if you heard more of yourself in one of those over the other, if you heard yourself more in the inflammatory, the tendonitis category, or if you heard yourself more in the tendinopathy, the degenerative category, you want to treat those very differently. And
And
so,
then where does
yeah,
the osis fall into that then?
yeah. So this is where it gets it gets a bit of a debate with different healthcare providers. Tendinosis, as I like to describe it, is a little bit of that in between. Now, this isn't like a continuum of you go from tendinitis to tendinosis to tendinopathy, but you can kind of think, to make it simple, you can kind of think of that as you have a tendon problem that's been persistent for more than a couple of weeks, maybe up to a couple of months, but these tendon injuries are not going to have those degenerative long-term changes that a tendinopathy will have. And so the person with the tendinopathy, the degenerative change to their tendon, is going to be more like that nylon hammock where the tissues are more disorganized and they're not designed to pull in one direction. They're a little bit more like scar tissue. Tendinosis, you can think of it as kind of the light version of that.
And I know in the article you put together a table that kind of helps guide the process, right? That allows, climbers to be able to go to a table and say, okay, here's a definition of each, here's the typical time frame, here's accompanying symptoms, and then really getting into the differences between treatment. And I see on the screen for those of you who are viewing, this is the table that Evan had put together. So kind of walk us through. The table's detailed, so to keep this engaging, and keep this going, maybe go through the 30,000-foot view of the table of really why this matters, like how a climber can use it, if they do have tendinopathy.
Yeah, exactly. So if you found yourself agreeing with those descriptors of it being tendinitis, this is something that we want to rest. We want to let the inflammatory process go through, run its course, because that is an important part of healing. And if we load the tendon too much during this time, we can aggravate the tendon further. And so I typically recommend resting anywhere between 7 to 14 days for these types of injuries. Um, a lot of research shows that the inflammatory process is done within 72 hours. A lot of times it can last for a bit longer than that, and we want to be cautious with this. These are the pesky injuries that can take a lot longer to get better. And so if you're more thinking that you have a tendinitis, you want to play it a little bit safer and you want to rest a little bit longer. So typically at least 3 days and typically 7 to 14 days.
So
If
let's
you
say,
are on,
oh,
yeah.
sorry to interrupt. I had a question on that then. So let's say a climber comes in, they have tendonitis, and they've said, okay, I fit all those criteria. You had acute injury, etc. There's this achy, sharp pain, and it's on the outside of my elbow. And they decide I'm going to rest for a week, just try and see if I can calm this down. And I see on the chart too, there's reduced inflammation and pain, and obviously you can utilize ice or components like that to reduce some of
Mhm.
that. Where does splinting and bracing come in? Like, is that something if someone does have a tendonitis that is appropriate during that rest stage, or is that overkill? And again, this is your thoughts, like kind of your personal preference of a
Mhm.
climber that comes in and fits into that category.
So it will depend a bit on the structure itself. For the most part, in my practice, I don't do a ton of splinting and bracing because we want those tissues moving. And so when I say rest, think of it as relative rest. You should definitely not be climbing, but it doesn't mean you can't do other activities, and it doesn't mean we don't want you moving your body still and moving that area. And so one of the things I will splint is what we call de Quervain's tenosynovitis, fancy name for pain in your thumb, in the tendon in your thumb. That is one that in particular tends to really like bracing and responds really well to that. A lot of the other tendinitis injuries tend to, I find, do pretty well with general movement and relative rest, decreasing the load quite a bit. And there are some things you can do, like taping, to help promote blood flow into the area and help that inflammatory process, as well as some massage techniques that can, again, help increase blood flow into the area so that the inflammatory process can be more effective.
Got it. So you recommend typically like an active rest, except for some specific conditions that have been shown in the literature to do well with immobilization.
Exactly.
All right, so that's tendonitis. I get that. Well, what about tendinosis tendinopathy? How's that different?
Okay. So if you found yourself falling into that tendinopathy, tendinosis category, where you've been climbing for a long time, you've had multiple tendon injuries over time, a lot of times what's happening is those structural changes to your tendon are happening under the surface without you realizing it. So that climbing rope is turning more into the nylon hammock, and that can be not painful until we push it too much, and then it becomes painful. What our research shows is that if we rest those tendons, they get worse. The pain might go down, but their capacity also goes down. So your pain will go down, but then you get back to climbing and then it hurts again. So you rest a little bit more and your pain goes down, and then you get back to climbing and then it hurts again. And a lot of us have probably been through this cycle before. Tendinopathies, as it turns out, respond really well to loading. And we want to be safe and systematic about how we're loading. But based on the structure and components within the tendon, if we give that tendon a continuous pull, it will actually reduce the sensitivity in the tendon and reduce pain. And if we load that tendon safely and systematically over time, it will rearrange its fibers to turn less into a nylon hammock and more into a climbing rope. And so these are the types of injuries that we can start loading very shortly after the injury occurs.
And there are many ways to load. There are, let's say, concentric exercises where, let's imagine a bicep curl, you're like lifting that weight and bending your elbow. There's eccentric, you're like slowly lowering down that weight. There's isometric, you're just holding that weight in place. Is there a best way to load? And I know in the article also you talk about this and talk about each one. So maybe go a little bit more in depth in the best way to load.
This is a good way to get PTs and other healthcare providers riled up because we all tend to get in our have our horse that we like betting on, and of course our biases drive the way we interact with our patients, and it really drives our outcomes as well. When we look at the research, the idea of doing eccentrics only is not holding up as well as it was 2 decades ago. So that eccentric phase is that lowering phase. And so if you have if you have a biceps problem, a tendinopathy in your biceps, and you're doing a biceps curl, the eccentric phase is that lowering phase where you have your elbow bent and then you're straightening it out with the weight in your hand. The eccentric phase is causing a lot of irritation to the tendon, which is important and crucial for the tendon healing process. But eccentrics alone don't seem to be better than just doing the full range of motion movement. So doing a concentric and eccentric movement. There is research to support eccentrics alone. There is a lot of research to support doing concentric and eccentric at the same time. I use eccentrics alone when the concentric movement is painful. So if we have our biceps and you're doing your biceps curl, and as you curl upward and your elbow bends more, and that is causing you pain in the biceps, but as you lower down, you don't have any pain, now we can use that lowering motion to get a little bit more out of the exercise. Because ultimately, we want to load the tissue as much as it can tolerate without causing it to be excessively painful. So if for the first 2 weeks of a rehabilitation program, you can only do the lowering phase because the raising phase is painful, then let's just do the lowering phase. Then when your sensitivity goes down, that's when you're going to want to start doing both directions. As long as you can tolerate it without causing excessive pain, then you're going to be safe to do that. And based on the research I've seen and based on my clinical practice, I think that's going to be a better way to rehabilitate the tendon.
Got it. So you, just
Yeah.
to kind of reiterate, so you have isometrics, eccentrics, concentrics. There's literature to show that eccentrics do work, but that was 20 years ago, but there's also literature that shows that concentrics and eccentrics do work, and some even that combine isometrics. And you can use pain as a guide, especially during contractions, for example, the eccentric that you talked about, that's pain-free, to almost ramp a climber up into a program without irritating them. And so you can almost, all these seem like they work, but you can pick and choose based on pain to create like the most gradual ramp up for a climber so it doesn't flare them up. Is that what you're saying for each of the contractions?
Exactly right. Ultimately, we need to load it. We need to overload the tendon. The way you do it isn't going to matter so much in that one is better than the other, but we can use certain techniques to get you to be less painful and less aggravated. And another thing is isometrics have really good research showing that they are really good for pain. And so if you have tendon pain and you load your tendons isometrically, so not moving the joint, but still putting load on the tendon, that can be really beneficial for pain. And we can talk about some of the protocols later, but that's another thing to consider. And I think the biggest thing is starting off simple with single plane movements, curling the biceps up and down and back and forth in one direction. But of course, we need to progress to something more functional, something more sport specific, and something a little bit more dynamic. So we start off simple and static and not moving very quickly, and we progress toward compound, multiple joints moving, and a more dynamic, heavier load, which mimics climbing. So progressing from a biceps curl to a chin up or a pull up, as an example.
All right, so a climber, they're like, okay, I understand, I've identified if I have tendonitis, tendinosis, or tendinopathy. They say, okay, I've now chosen my load. So I know I want to do concentric, eccentric, isometric, or a combination of those. How long does it take for them to get better? Like, is this something that just like, a couple weeks, 2-3 weeks, good to go? Or is this like a long-term injury? And I know it depends on the body region, but in general, how long does it take tendons to heal, or at least for a climber to feel better so that they know that they're at least on the right track?
The question everyone wants the answer to: when can I get back to climbing? So It definitely depends on the intensity of the tendon injury and the extent of some of the degenerative changes that have occurred for people with the tendinopathy. So if people have been really neglecting this injury for a long time, it's going to take a lot longer. We'll start with the bad and then get better over time. Well, bad news first, right? So what the research is showing is that if you have a significant degenerative change to your tendon, it can take between 6 months and a year for that tendon to fully heal and go through that reconstruction process where it gets closer to looking like a climbing rope and less like a nylon hammock. And so those are the people who have been really neglecting those tendons for a long time. It's going to take them 6 to 12 months of progressive loading to cause that healing. Now, if this is a newer injury and you've injured it for the first time and you stopped right away, I see a lot of people get back to climbing near their full capacity within 3 to 4 weeks. And so typically in the middle of the bell curve, most people take anywhere from 8 to 12 weeks for their tendon to fully recover and for them to be able to load it at a capacity that they were at before. And so that's the general time frame. That'll be the majority of injuries, is between 8 and 12 weeks. And then the people who have had fewer injuries, or this is the first time and they take really good care of it, 3 to 4 weeks. And the people who have a lot more things going on can take months and even up to a year or maybe longer.
So there's some variability, but that at least gives some guidelines for climbers to know and understand. So what's next? Okay, so they know how long it takes to heal. They've identified their category. They've loaded these tissues. How do they know how to progress?
If you are loading the tendon to a certain amount, the tendon will tell you what the right amount of load is. So let's come back to the biceps curl. I do my curls with 10 pounds and I do a certain number of sets and reps. Let's make all the PTs angry and say 3 sets of 10. That's like
Just because that's like the cookie cutter amount.
it's the cookie cutter thing.
Yeah.
Us PTs love to not be cookie cutters, so we'll intentionally choose not 3 sets of 10, but
The
we'll
devil's
start with
advocate could say, "Oh, but that's three boulder problems, right?" Or that's, but anyway.
absolutely right, right?
All right, keep
So
going.
we got our 3 sets of 10, and I'm doing my repetitions, and oftentimes that tendon will feel good, and it'll actually maybe be a little bit sore on the first set, and then it'll feel better on the second set, and the third set I'll be feeling awesome. And if I'm smart, I will call it good there because that's what my physical therapist told me to do and told me to stop at. And then I will wait until the next day and assess how my tendon feels. And so these are called the soreness rules. I like to sometimes call them the red light, yellow light, green light rules because it tells us, should we progress, should we stay the same, or should we regress? And so if you do your 3 sets of 10 with 10 pounds, and the next day your symptoms are worse than they were the day before, then that's a red light and you want to decrease the amount of load you're doing and take an extra day off of that loading program. So the next time I come back, I'm either going to do 3 sets of 10 reps with an 8-pound weight, or I'm going to still use the 10-pound weight, but I'm going to only do 3 sets of 6 reps. So I'm decreasing the load. If your symptoms are the same the day after your loading program, then that's a yellow light. Proceed with caution, keep it at the same level. Don't increase the amount of load, don't decrease the amount of load. And if the next day you're actually feeling better, like you can do more with less pain and fewer symptoms overall, then that's a green light and you can go ahead and progress. And I typically tell people to, when they're progressing this, in the earlier phases, start with about 10% progression per week. And then you can, as you get better and better, you can progress more like 20% per week as the pain goes down.
So any last thoughts or last ideas, climbers that have tendinopathy? Any words of wisdom?
The biggest thing is, as usual, to talk to your healthcare provider. Tendon injuries are very commonly misdiagnosed. And so if you have pain in your fingers You need to know, is it a pulley or is it a tendon? If you have pain in your elbow, is it a tendon or is it a nerve problem? Someone needs to diagnose that for you. If you are trying to experiment with it on your own, if you do a long sustained isometric contraction, tendons typically like that. And so, one of the protocols that works really well for reducing tendon pain that the research really supports is doing 45-second holds and then resting for 2 minutes, and then doing that 5 times consecutively. And you want to be loading that tendon at an amount that kind of makes you shake a little bit, where you have to really focus on it, but you're not totally exhausting the tendon or the muscle. And you can do that a couple times per day. And so that's a really good starting point if you've identified with your healthcare provider that you have a tendon problem. Doing those long sustained isometrics work really well for reducing pain. And then over time, we want to progress the load on the tendon. And so in general, we want to just be aware of if we should be loading the tendon or not. But in a lot of cases, we are okay to load that tendon, and we want to just be smart and systematic about how we load it and how much we load it.
Yeah, and I really like this article you put together because it is a systematic framework and it allows climbers to classify themselves. And I think that's really the direction we have to head in is one is classify yourself, or like you mentioned, go to a medical provider and figure out it may not even be tendinopathy, it may be something else. But then having some structure to be able to progress through. I think this article is laid out quite nicely.
Yeah, and that's what as a climber, I'll say this, that's what I love and hate about climbers is that, we're going to try to do it ourselves. That's just what we do. We try to figure out the best beta for figuring out everything in our lives, and injuries are no different. And so, start on your own. That's totally fine. But if that's not working and not giving you the results that you want, then definitely go to a provider because there might be a misdiagnosis. There might be other things to consider. Just other things to consider are your total health, your diet, your sleep patterns, the amount of rest you're getting, the amount of stress in your life. All these things have really, really big impacts on your ability to heal. Consider those if you're not getting better, if your pain isn't going away, but you seem to be doing all the right things. Tendons are oftentimes the victim, and the culprit tends to be a lot of things elsewhere, like your movement patterns or some of the other things that we're doing for our general health.
So, Evan, where can people find you?
So the best way to get in touch with me is just over email. I'm at evan@mendcolorado.com, and that's also our website, mendcolorado.com. I'd love to hear from you guys and love nerding out about this stuff, so shoot me an email.
All right. Well, thanks for coming on and talking about tendons.
Happy to.